Hello everyone, Dr. Alex Vasquez here, bringing you today clinical review of vitamin D deficiency in adults, part 2, focus on brain dysfunction. Today I'm going to divide this presentation into 4 parts, but I'm only going to give you 3 parts. This entire conversation has at least 4 parts: the introduction and contextualization, which I'll post in kind of a longhand form on my academia page, as you can see listed here. The introduction and contextualization of the earlier versions and drafts and attempts at this presentation added at least 45 minutes. So I've decided to exclude that material from today's presentation. And if you want to see that information and download it, you can do that again from my academia page or perhaps from my website. Again, posting that information online will save us 45 minutes right now. Everybody wants the take-home message, but keeping things simple keeps people happy, but it also keeps them trapped in simplistic models and perceptions. So this quick video version that you're about to see right now is a slice of the biological psychiatry slice of the pie. So when we talk about depression, for example, we mostly have 4 different camps that have kind of dominated that conversation. These are psychiatry, or perhaps better known now, according to one of my attending physicians, he says it should be called psychopharmacology. And the second camp that I describe here is kind of a merger of psychology and sociology, which in contrast to the psychiatry camp, which says you need drugs, the psychology and sociology camps say that you need a healthy external environment and you need to be internally adjusted to that environment. The religion and morality camps will say that you need God, morals, redemption, and reconciliation. And the camp that I'm representing in this conversation is the biology or biological psychiatry camp, which might be summarized by saying you need a healthy internal environment, meaning your biochemistry, your nutrition, your microbiome, your hormones, and an external environment that supports health. So again, we're kind of looking today at depression from the perspective of biological psychiatry and only a very small slice of that. So that, of course, leaves out many other conversations we could have on this topic, but I'll let you access my perspective on some of those conversations in the document that you can download from the internet. So I'm going to focus right now in this presentation on depression mimics and contributors, just for the sake of completion, including the fact that any, all, and each of the nutritional deficiencies can cause mood, behavior, and depression disorders. I'll talk about biological plausibility relating vitamin D to brain dysfunction. And then in part number 4, I'll talk about clinical evidence. So again, this entire presentation has 4 components. The introduction and contextualization will be available online. Then I'll talk about parts 2, 3, and 4. Depression mimics and contributors, that's part 2. Part number 3 is biological plausibility of vitamin D in mood and behavior disorders. And then part number 4, of course, we'll focus on looking at clinical evidence, and we're going to look through about 25 years of clinical research. So, having couched it as such, let's move forward right now and jump into the first part. So this is part number 2. Part number 1 on vitamin D deficiency in adults focused in on pain. So I invite you to have already reviewed, hopefully, that video, and then retain some of that information so you can build upon that information in today's presentation. I previously reviewed what are the 3 locations of physical examination for vitamin D deficiency in adults. Name at least 3 mechanisms by which vitamin D deficiency most directly contributes to pain. I think those top 3 will be quite obvious to you after watching the part 1 video. And then name at least 3 more supporting mechanisms by which vitamin D deficiency contributes to pain chronification. You should be able to name at least 3 more, if not 6 more. Question number 4 in my quick review quiz: what is the defining and differentiating level of 25-hydroxyvitamin D at which parathyroid hormone levels become normalized? That's a very specific number. Obviously, you could go plus or minus a little bit, but the number for this level of vitamin D that normalizes parathyroid hormone levels is actually quite precise. So give or take a few percentage points, we all should have pretty much the same number there. What is the physiologic impact of altered parathyroid hormone levels, and how does this correlate with population trends in general health? So those are some questions that you might be able to answer to then build on to that foundation as we advance the conversation today, focusing in on depression and mood disorders as related to vitamin D deficiency. For the sake of completeness, I am going to allow myself 2 pages to talk about depression mimics and contributors, and then we'll dive into biological plausibility and then 25 years of clinical evidence. So, I think that depression is probably one of the most overused terms in casual conversations and certainly within medicine. So let's talk about some things that kind of look like depression, but which are not depression per se. So we all use the term depression, but depression might be a lot of different things that maybe aren't the medical view of depression, which of course needs drugs. And certainly some people need drugs if they're in an emergency situation, if they're in a crisis, if they're violent, if they're delirious. Let's sign them up for some chemical sedation for a while until the storm, the emotional storm or the inflammatory storm kind of passes and they're able to regroup and then kind of regain maybe some new resources to help them cope with whatever problem they were having in their existence. But let's not call everything depression and then think it needs neurotransmitter balancing and pharmacotherapy. Let's not do that. Let's think about some other words that we could use to describe situations when people might be presenting with what we might otherwise want to call depression, but it might be something else, such as disillusionment, disorientation, despair, nihilism, neuroinflammation, boredom, creative overwhelm, burnout, exhaustion, or so-called moral injury. That's the new phrase, at least in the medical